The South African Paediatric Association believes that the issue of the wearing of face masks by school children could be better managed. The association says it supports the use of masks in appropriate selective circumstances rather than the ongoing universal approach. Let's talk about this then with Professor Mignon McCulloch from the Red Cross War Memorial Children's Hospital. Prof, always good to have you on Newzroom Afrika. So why is this the time you think to stop universal rules around the wearing of masks by children at school?
Thank you very much for having me on your show once again. And we've been watching what's happening in the community. We've also been listening to advice from the WHO and UNICEF, which are both involved in children wearing masks. And as we've said from the beginning, the young kids under 6 do not need to wear masks. They are not really able to wear masks. And the children who are behaving more like adults, the adolescents, are the group that you may want to talk about wearing masks, but the group that we are looking at are those children between 6 and 12. What we've seen is that children actually find it very difficult to wear well-fitting masks, and we're not even talking material masks, but we're talking medical masks. And so we know that in South Africa, in addition to a lot of people now thankfully being vaccinated, many children and adults have been exposed to this virus, have had it and have developed some kind of immunity. Mm-hmm. And so what we are saying is, if you are not a high-risk child, if you're a normal child and you are at school in the summer or in the winter with some spacing between you, then possibly wearing a mask is not going to be of any advantage to you at this stage of the pandemic. I think in the beginning we were all very nervous. We didn't know enough about this virus. But now we know that the kids that we may want to be protecting are those that are high-risk individuals, those that have got medical problems, those that potentially live in areas where family members have got significant medical problems. But on the whole, what we're saying is that seeing as most of us now have been exposed either by vaccine or by, in fact, getting COVID, being very strict about wearing masks does not seem to be ideal. And so we're wanting to go for a more flexible approach.
Right, so just on that, to be clear, is what you are suggesting as the Paediatric Association that as far as children are concerned, on the issue of masks, the advice would be wear it if you wish?
Absolutely, and we are quite firm on that. So if a child feels vulnerable and they feel they want to wear a mask, we should be encouraging them to do so. We shouldn't be saying, well, you don't have to wear a mask. But we know that with lots of children with developmental disabilities, learning impairment, speech impairment, that masks can actually be detrimental to those children in terms of learning. So for those kids who do not have any medical comorbidities, so we know that there are those with respiratory problems or those who are immunocompromised, those children may wish to wear a mask. And if you are going to be wearing a mask, then make sure the mask fits properly. It covers not only your mouth, as we see some people even wear it as throat warmers. We're saying wear it over your mouth and over your nose so that it fits well. But I think we've had this virus with us now for 2 or 3 years. I think we all know what the rules are, and if you are going to wear a mask, then you should wear it properly. And the recommendation about masks at this stage for medical indications would be a medical mask, not just a material mask.
So how much does each child's socioeconomic context matter, I wonder, with this recommendation? Because, as you know, in the classroom, for example, a private school in Johannesburg would have more resources, more space, for example, to allow for distancing than a township school in rural South Africa. Is there a need to make a distinction, or is this an across-the-board thing outside of considerations for kids who may be immunocompromised and the other categories which you've set out?
So you're spot on there. We've never been absolutely adamant about anything. We've tried to give guidelines and then have said to people, use common sense and try and apply it to your environment. Ironically, those people who come from backgrounds where there is overcrowding at school often live in overcrowded home environments as well. And so those children have probably been exposed to the virus and have some natural immunity to it already. Obviously, in the summer, it's much easier to ventilate your classrooms, to open the doors, let kids play outside. I think this week has been particularly horrible in terms of the weather, and so you can't be keeping your windows open. It's freezing cold and there's lots of rain. The other issue that we also are encouraging is the vaccination of adolescents. And we're saying if you haven't had natural immunity, then making sure that group of 12 to 17-year-olds, especially those that have got high risk, should be vaccinated. And there have been some interesting studies that have come out this week that have actually shown for Pfizer it's actually safe in children from 6 months of age upwards. And
should
so
South Africa move in that direction, Prof, as far as
Yeah.
making vaccines available to children of all ages? Because as you're saying, in America now, they're trying to give it to children as young as 5.
So we've actually just at the same time as this statement for masks, we've also rolled out a statement about urging vaccination of children from 5 years upwards, particularly those who are immunocompromised or have medical risk factors. We've always said the most vulnerable population are the older people, so make sure those older people are vaccinated. Make sure then your teenagers are vaccinated. But if you've got a child who has got some medical conditions, we are actually encouraging the government, because we've always worked really closely with the government, to say maybe we should be looking at rolling it out for the younger kids, specifically those that we work with in the medical field who have underlying comorbidities.
Professor Mignon McCulloch, good to have your time as always. Thank you.